Hello, everybody. Very good to see you all again. And today I'm very pleased to introduce you Anna Cooper and Gabz Pearson, who are the founders of the Menstrual Health Project, which is a UK-wide charity that focuses on creating and delivering educational tools and resources, along with helping and providing practical support for people navigating all aspects of their menstrual health, from periods all the way through to menopause. So basically, touching a huge number of females or people that menstruate in this country. So welcome, Anna and Gabz. Now, I know the reason that we're speaking is because I was introduced to you via, oh, her name's gone right out. Was it Stacey? No, I can't remember. Kirsty, that was it, Kirsty. Because Kirsty shared with us her journey with endometriosis, and she was very keen that I met with you to talk with you because of the valuable work you're doing with your charity. Now, and I know that the reason that you two got together was based on, as you term it, which I thought was very fitting, the mutual demon of endometriosis, which is a shame, but you did it via Instagram, which is obviously very interesting in how communities form and understanding. So welcome, both of you.
Thank you. Thanks for having us.
So we've got lots to talk about today, and I know that we've got 5 points that we want to sort of get through because it just touches so many things. And I think what I think is very interesting, the fact that you both have endometriosis, but you're covering with your charity so many other things. And as we discussed earlier, endometriosis is one of those, I think was it 6 or 7 years generally for an average diagnosis. And in that point, you've gone through a whole range of other things that people have suggested you may have. So that's why it touches so many people when they will have gone on the same journey or maybe going on that journey for diagnosis. So if we start off with talking about I think one of the things that you wanted to talk about first of all really was about the menstrual health that we get in the workplace. Well, actually, I wonder if we should start in schools, because the journey does start when people start menstruating. So welcome your advice and thoughts about education for schools.
Where do we start? I think for both of us, because we started our periods really young, we were 10 and 11, and Anna's in North Wales, I'm based down south of England. And I think when we met, we kind of realised how terrible the education was for both of us at school. And I think for us, that's really impacted our journey being diagnosed with endometriosis and other related conditions. Like for me, when I was 10 starting my period, it was so painful, debilitating. School was really difficult. There was no support in school. I remember leaking really badly on my first day of year 7 all the way through to my school skirt, wrapped my blazer around me, went to the school nurse and was just given a wet paper towel. There was no spare clothes. There was no period products. There was no one to say, this isn't normal, that you're bleeding through your skirt all the time, that you're in so much pain. And it's similar for you as well, isn't it?
Yeah, I think I started at age 11 and I wasn't told anything about periods beforehand. And I remember it was my 11th birthday party and we'd rented the village hall, and I went to the bathroom and I just had blood everywhere. And I thought I was dying because nobody had told me anything. And like my mum, bless her, is like, she was great later on, but she was a nurse, and like you would think I would have some sort of understanding younger, but because of the way society deems talking about menstrual health and periods, it just wasn't spoken about. And my mum was one who, you can know, hid the tampons and the pads in her trolley and just didn't talk about anything. And I think that's not her fault. It was just the way she was brought up, and the way society has made her feel has made you feel that you can't open up about these subjects. And we have to understand that we have to prepare young people earlier than what we would think you would start our periods. The youngest person in the UK now is 7 to
I think
start
when
their
we were
periods.
younger as well, it was deemed like abnormal to start your period
Yeah.
that young. But I think there was so many people our age, we're early 30s now, that started around that age. So I think it's changing that whole narrative around, like you said, when people start,
Yeah.
kind of the products, how people are having periods, because we don't want another generation worried to talk about periods, thinking it's dirty, shameful, embarrassing, and that kind of stretches to things bowel, bladder.
Yeah.
When you're young and you're starting your period and you have no education or kind of understanding, you then internalize a lot, and then you're not as open to discuss if things are happening with your menstrual health or your periods that you don't want to talk about.
Yeah, I think we have to recognise as well, teachers have so much on their plate already, so they can't be expected to know about this stuff. But what a school can do and what councils can do is bring organisations like us in if they need support to be able to kind of help, which is what we've done. We've done so much work with schools, which is incredible that they're so receptive to the help, is that we help kind of guide them and give them the knowledge, even if it's just that where they recognize if somebody's off school so much, you know, every time of the month, that they go, actually this might be something, this you need to speak to your doctor about this. Or, you know, if they're crippled in pain every time they're, you know, kind of on their period, or they're going to the toilet so many times in class. And I think it's bringing awareness to the fact that young people can have conditions like endometriosis, they can have PCOS, they can have PMDD. It's such a myth that it only impacts people in their kind of 30s and above. It's just because we don't diagnose it quick enough, and we don't diagnose it at an early age. And like for me, I was lucky I was diagnosed 2 weeks before I turned 18, but that was only because my dad took me privately. And I think a lot of people don't have that, and we're even worse now to diagnosis. We're 8 years and 10 months across the UK. We're a decade nearly in Wales. Like
there's over
750,000 women
now
waiting
yeah.
for gynae care in England alone.
It's
And
risen in the last year.
yeah.
So if we could catch this earlier in schools, I mean, do schools have school nurses still, or?
I think
it varies.
It
doesn't
varies across the country regards to funding, and that is solely what it boils down to, is the funding pots that they get given. And you know, here in Wales, we've got a period dignity grant that a lot of schools and colleges get, so free period products everywhere, which is great. And but again, it's about accessibility. We've gone into schools in Wales where they didn't even know they could get free period products, even though it's readily available. They didn't know where to access them. And it comes down to, how can we make it less scary for young people to kind of access
that's why we did our toolkit as well, the menstrual health for under 18s. And when me and Anna did it, it was kind of, what is everything we wish we had when we were a teenager, younger, at school, kind of navigating periods. And it's kind of a how-to guide and a bit of kind of I would say kind of a comfort for people to know that they can find out if there's anything abnormal about their periods, what the best period products are for them, talking to a doctor, tracking their symptoms as well. Because me and Anna were saying that kind of we didn't track our periods or kind of track a lot of things until a lot later in life. And early intervention and kind of investigating these things early doesn't mean it's going to completely prevent it, because sometimes it's not preventable, but it's just giving you the best head start so you could have a better quality of life. Because I think for me and Anna, where we've had such a difficult journey, like for me, it took 7 years to get diagnosed, and I was constantly told I had IBS, and I had doctors dismissing me. And then I've had it on my bowel, my bladder, my womb, my tubes, everywhere. And for me and Anna now, Anna lives with 2 stoma bags and has had a full hysterectomy. I've got permanent damage to my organs. And if we'd have been listened to earlier, where would we be now? Would we have a better quality of life? Would we have better chances with mobility, fertility, work, all of these things? Because it impacts and seeps into every area of your life. It's unstoppable.
Yeah.
So it's really just giving people that confidence.
So what you've just mentioned, which we will be putting on our website, you do have a couple of toolkits with a new one coming out in the next few weeks as well. So we won't talk about those, but we will put them on the website for people.
Yeah.
So those are ones that we'd encourage people who are mothers or parents, or people who look after people who are school age, is to maybe introduce it to their schools as well, because it's
definitely
knowing where you can get help is one of the biggest step forwards, which I think is what you're saying.
Again, yeah, massively. I think, again, it boils down to that we just haven't opened up about this subject, and we've ignored it for far too long. And I think that adds to the kind of struggle of getting diagnosed and having that issue. So like Gabs, I suffered really heavy, painful periods from the get-go, and it probably got to maybe 13, 14, where it then was things like rectal bleeding. It was UTI symptoms, but not having UTIs. And no one knew where to put me. They didn't know what was going on. Whereas when both me and Gabs look back, and we've worked with so many medical professionals, you think, all our symptoms were literally a checklist of endometriosis, but medical professionals didn't have the tools to be able to, and we're talking about primary care practitioners mainly, because they don't have enough time in their kind of clinics, but two, they don't get the training. Up until recently, they got to choose whether they did a rotation on gynecology and obstetrics, whereas now it is mandatory. But that we have a whole generation of doctors who aren't aware of the kind of signs and symptoms of endometriosis, and also it comes alongside kind of the myths that come with that. So the pill will cure it, pregnancy will cure it, hysterectomy will cure it, and none of that is true. And I'm living proof of that. I have had a child and I've had a full hysterectomy, and it's still growing and still causing problems. So I think it's getting the right information in the right place for people. And we live in an age where information is at our fingertips because of social media, but unfortunately that comes with a lot of misinformation. So it's knowing where to look for that information, especially for young people, because they're all on their phones trying to access things. And if they're able to come across organizations like us, and there's so many other amazing organizations that are doing work, is that they have that quality information that is kind of vetted by medical professionals, that they know is to the NICE guidance and to the NHS standards. So they know if they take those resources to GPs, that they can't refuse them that kind of help.
Because that's what's hard, isn't it? And I think a lot of people, if they don't have the right information, they go to a doctor and a doctor says, you can't have this, you won't have this, you don't have this, off you go. A lot of people be like, oh, okay, well, the doctor said that, so that's gospel, I'll take that, I'll just suffer in silence. But at least now people can feel empowered to advocate for themselves and feel confident to say, that's not right, I'm not happy with that doesn't sound right, I want a second opinion, I need help, and really advocate for themselves. Because as much as people can advocate on your behalf and support you, you have to be your biggest advocate. You have to do that fight, as much as it can be really testing and draining, especially as a younger person. And I didn't have that confidence when I was younger, and I think a lot of us didn't. Now I'd advocate for anybody tenfold, but it's about giving people that tools and the confidence a lot earlier to stop these long wait times for diagnosis, stop people ending up with stoma bags, wheelchairs, all of these kind of secondary conditions that come as well, because we can't keep going on like this. It's just unacceptable for people.
I think we're up against it at the moment with the way the waiting lists are. You know, we have up to 5 years, we've heard, waiting for surgery for endometriosis. And I think we need to be able to give the resources for people to access the help as early as possible, because that will then kind of reduce their delay in getting a diagnosis long term. And we have heard like people using our toolkits and then getting diagnosed is incredible, which that it's helped guide them to get to where they need to be. And I just think that is important. Like Gab said, we're not going to get rid of it. Unfortunately, it's inevitable. If somebody's going to get endometriosis, one of those conditions that we cannot cure, but it's getting the help early, and early intervention can be key in managing the symptoms. And things like, for myself, like I lost my large bowel and my bladder because of it, and that was due to a lot of delay in my treatment. So I think we need to avoid this such life-changing, like permanent damage that happens to the body. And the only way we will do that is early intervention. And I think the more information people can have, whether that be the individual themselves or their parent or their partner, carer, teacher, anybody to help guide them, I think that level of knowledge is so powerful. It doesn't matter who you are, and doesn't matter what gender you are, because I think you're going to know somebody who menstruates and who suffers with their periods. So information is vital for everybody, and I think that's, as a Menstrual Health Project, we're really kind of ensuring that all genders are involved in the conversation, and that it's not just one-sided.
Yeah, and I think what you've said is key. For me, for someone who doesn't, I don't know, or maybe people haven't, I'm of a generation where people wouldn't have spoken about it for sure, is the damage it does very quickly, which, you've experienced. You've lost your bladder and your bowel. I mean, how serious does it have to get for someone to take notice? So I think for me, the key message is understanding it is not a heavy period.
Yeah,
that's not what it's about.
The whole body condition.
I think the sooner they recognise or change the kind of definition of endometriosis, especially, the better. I think we need to stop calling it a kind of reproductive condition or a period condition. It is a whole body condition because it impacts the whole body. It has a real ripple effect on the nervous system.
And if it's not the endometriosis itself, it's the adhesions that can spread. Like, when I had my 5th surgery in February, I had adhesions from my pelvis on my left side all the way up to under my rib. And all of my endometriosis had been kind of around my pelvic area. So it had spread that high within about a year. And it's scary because I was saying to Annie yesterday, what if that goes even higher to my diaphragm, lungs? And that's really dangerous. I mean, it's dangerous anyway with endometriosis, but when it's impacting vital organs like your lungs, your diaphragm, bowel, bladder, like it's so important. And I think it's recognizing the long-term damage that people have to live with, incontinence, fertility issues, mobility, all of these chronic pain. And I feel like it's really hard still sometimes to be taken seriously.
Yeah, definitely.
And to say, if I don't have this help, where am I going to end up?
So the next thing, moving on, so I think what we've done is made it very clear as to why it's important to get the knowledge into young people as soon as possible, and the best way is to target the schools. And then also the parents at the same time can target GPs as well to go fully informed when you go to the GP and not be flipped off. Moving on then to the workplace. Now, how do you feel you can support the workplace?
I think with workplaces, it's a really good opportunity for them to understand what the condition to an individual. There's going to be a huge amount of time that a kind of people with these conditions will have to have time off work or need adjustments in work. But it's to understand that that doesn't mean they're any less of a worker. And that is one of the kind of things that we find from, like, I was very lucky in my workplace journey, but Gabz wasn't so much. And I think we hear it far too often where people are dismissed for their kind of multiple times off, or
they get pushed out.
They get pushed out, kind of bullied in a way of being made to feel that they're not good enough. And I think that is the huge issue, is just because somebody is unwell doesn't mean they're any less of a worker. I think you'll find people will work 10 times harder to prove a point when they're poorly, but then end up in burnout, which is what makes them then
what do you want the workplace to do?
I think with the workplace, they need to have, because it's not mandatory that they have policies in place for things like women's health, menstrual health, and all the different conditions. So I think more companies and businesses need to be putting better policies, or policies full stop. They need to have training. So with our toolkits, kind of one of our long-term goals is to turn it into e-learning for schools and workplaces. And it's not just kind of a one-off when you start, you click through. We want it to be kind of a reoccurrent one. So having e-learning, having us go in, and there's lots of other organizations that go in as well. But it's really having a better understanding, being more flexible. And I think a lot of businesses sometimes will not be flexible until it gets to the point where they have no other choice. So it's starting that earlier so people can stay in work, they can sustain employment, and just making it a bit more, making the adjustments that people are entitled to. I think that's the problem. Is like, for me, I have had a really bad history with work where they never wanted to make the adjustments, or they would do the bare minimum. I'd always hit sickness triggers. I'd get disciplinaries. I'd go to occupational health. I'd come back again. I'd be off sick. I'd have managers that wouldn't check in with me. I'd come back to work. I'd be completely grilled and ostracized by my managers about my condition. And it's just this whole culture of people not understanding. So I think that is a big thing, is the empathy, having better knowledge and making it so people can be within an employment. Because I think for both of us, we saw our careers and our work life going very differently. I mean, I feel like we've landed on our feet and we've kind of in a way fell into running a charity and being charity co-founders, which is a lovely fall. But if I didn't have this, I don't know where I would be, because I had to leave my job last year because I was so unwell. And like Anna was saying, like, you go into burnout, you're off sick, you go back to work, you have loads of work to do, you're off sick again, and you make yourself so ill because you're torn between, I need to try and rest because I'm not well, but you're constantly thinking about work, you're constantly worrying, how long am I going to be able to do this? Am I going to get sacked? Are they going to try and get rid of me? Am I going to be almost bullied in a workplace for being unwell? So there's so many different layers to it.
I think as well, for a workplace, it makes really good business sense to be supportive and to be flexible, because then you don't have a turnover of staff. You have a better retention. You also are going to get more out of that person and going to thrive in that business even more. But I think the crux of it is people don't understand menstrual health conditions. And I say menstrual health conditions quite lightly, in a sense that endometriosis especially isn't just menstrual, it's the whole body, but they don't understand it because it's never been spoken about. And I think that is the biggest thing, that if somebody then comes in to the workplace who has got endometriosis, for example, and doesn't know how to speak to their manager because their manager's quite standoffish or doesn't understand, and then they eventually pluck up the courage to talk about it, and the manager goes, oh, isn't that just painful periods? Or, you know, because they haven't got that level of knowledge. And I think everyone should be educated on this stuff, because
it goes with, sorry to interrupt, but it sort of goes with, I'm sort of trying to move the conversation forward to, because I'm aware of the other points we want to get in, is that it goes in the workplace with menopause and mental health. They're all the sorts of things of understanding, because they're all things that, you know, generally require unexpected periods of time that you're not able to work. And I think what you're saying is that if we could understand these things better, the stress level for everyone, the workplace to understand what they need to do, and for the individuals themselves, the times of not being at work shortens because we all understand what is happening. And so the stress levels, as you were saying, Gabs, about, you know, the stress levels that you were under were huge. If you didn't have those stress levels, the chances are you may have been able to go back quicker, easier, and also they might be able to make provision for you to work in an alternative manner, but still carry on in some fallback, which sort of leads us neatly onto talking about the mental health aspect of having you know, a menstrual health, I was going to say menstrual health condition, which is, you know, is what it is. And I think we were talking at the beginning of when you were younger, you were being questioned all the time about, gosh, it's just a painful period. And you knew in your body that it wasn't. But the amount of how that dents your confidence. And I think also, Gabs, you were saying as well, is that when you're younger, you don't have all the tools to fight the grown-ups and adults who theoretically know better. But we know that's not true. You're just being guided by your body.
It's very hard. And I think me and Anna have obviously done a lot of kind of soul searching since we've started the charity and the toolkits. And like for me, my periods and my menstrual health continued to be really bad all through my teens before I kind of started the process to get diagnosed. And I actually left halfway through year 11 because I had really bad depression, and I did my GCSEs from home. And it's only now looking back, the link between my menstrual health and my mental health, and also I'm waiting for referral for ADHD. So it's all of these things that kind of intertwined. And I think it really starts from when you start your period. We both didn't kind of have that medical support. And then if your parents don't have the knowledge, and then if you can kind of continue being unwell and your parents are kind of like, oh, you're just faking and there's nothing really wrong with you, because they don't know, they don't have the information. And kind of that's what I really experienced. Like my mum, she's amazing now, but when I was younger, she was very much just like, you just don't want to go to school, like you're being lazy, like all these types of comments from different angles. And I think it really does shape you as a person, positively and negatively. Like now we're both very like resilient and thick-skinned, but there's a lot of things where we really suffer with confidence, imposter syndrome. And I think now you still second guess your health, although deep down I still, when I went for my last surgery, I was like, I don't know, maybe I'm kind of just not imagining it, but maybe it's not as bad as I think it is. And when I had my surgery, my body was in the worst state it was. My bowel stuck to my pelvis, my ovary was stuck, I had really bad adhesions. So I was like, oh, okay, I can restore that confidence in myself. But it really then ripples into other areas of your life from having these kind of real pivotal moments kind of crumbled and diminished and not kind of gone the way that you would have hoped.
Yeah, massively. Very similar to Gabs. I think you have a massive amount of self-doubt. You just do. I think it's ingrained in you when you haven't been listened to. Very similar to Gabs last year. So I had sepsis after my surgery and I nearly died. And 3 months later, I developed it again. But I knew I was unwell, but I kept telling myself it wasn't as bad as I was. And
I was telling Anna, please go to hospital.
Yeah, and I just kept delaying it. And that was my downfall, because by the time I got to hospital, I went into septic shock again and nearly died again. I was incredibly poorly. But you almost convince yourself that you're not as bad as you are, because you don't want to have to face the battle that you think you're going to face. And like, I have, to be honest, pretty amazing medical professionals now in my kind of cohort of issues. But they are, I think you still have that fear. And I think that's what it does to you. If you're ignored and you're gaslit or you're dismissed, especially as a young person, that follows you through,
and that never go away.
It never goes away, and it ripples into every part of your life. Like, it's not just with medical professionals, it'll be in the workplace. You don't think you're as good enough, or you don't deserve the promotion, or in school you'll think, I can't achieve this.
It's like we won an award for the charity a few days ago, most dedicated women's health charity of the year, and when we got it, I was like, oh, I don't know whether we really like deserve it. There's better people that have got it. And I was like, shut up, Gabs, why are you saying these things? And like when we posted it, like we had so much support, and I thought, actually no, we've done so much whilst being really unwell physically and mentally. So I just think it, like Anna said, it really seeps in, and you really kind of second guess everything in your life then.
Yeah, and I think this is why it's so important for people to know the kind of knowledge and to be aware of what comments that they can make can really affect that person who's suffering. Because like for me, when I really wanted to go to uni, and I was diagnosed when I was sitting just before my A-levels, and then I went back the following year because I was like, I'm going to sit them properly, because I had cashing grades the year before. and ended up having surgery again. And I'll never forget, the careers advisor was like, there's no point you going, like, you're too ill. There's literally no point in you even trying. You're not going to get anywhere. And that just destroyed me, like destroyed my confidence. And I was lucky I got a job with Boots Opticians and did all my training and diplomas and everything, and worked my way up. But I still didn't believe that I was entitled to that, and that I, was kind of deserving of that, of just that job. I did, when I got it, I was like, do you really want me? You kind of doubt everything. And I think that's what it's so important for kind of parents, carers, teachers, just everybody to know that those comments that you make off the cuff, whether that stays with people for life. And I think it's knowing that it's not something to diminish, and it's not something to undermine, and these conditions are very serious and they can have a real effect on somebody. And it's not just that mental health aspect of having a condition that's never going away and having to deal with the chronic pain and all of that.
your previous life,
Yeah.
and all the things you kind of wish that you could have done.
Yeah.
And I think that is a constant cycle of grief. And I think especially for like me and Anna and a lot of people, where having a surgery, your endometriosis hasn't gone, you've then got secondary conditions, you've got kind of more health issues, you're constantly going through like grief healing, adding a bit of trauma in, and it's trying to constantly know how to navigate and actually get through while still being able to live, I won't say normal, because what is normal, but just have some quality of life to be able to enjoy even just the simple things.
Yeah, definitely. And I think it's so important to just be aware. I think that's the biggest thing, is just be aware that these conditions are very serious, and they're not just something that affects your periods and it's only that time of the month. And I don't have periods anymore because I've had a full hysterectomy, but yeah, I still suffer with chronic pain and suffer with the condition. And I think it's just knowing the information, just to be that bit more mindful, I think. And it's not anybody's fault because we've not spoken about it, but it's just being receptive to learning. I think that's the biggest point.
You mentioned two words there that I want to pick up very quick. One of them was resilience. And the other week we did a chat with Sally Baker, which was all about resilience. And the resilience comes from when you're a child. That's where you really build your resilience. You may build resilience when you're an adult and in the workplace, but that's different to your own personal resilience. And one of the things is illness, whether that be when you're a child, whether it be an illness yourself or illness with somebody within your family. And that's why I think it's so important of understanding and being able to not knock down people, which is exactly what you were saying, Anna, about those sort of things.
Yeah.
And then the next thing that you mentioned, which we'll just touch briefly because we have discussed it, although you have mentioned the word gaslighting, but it's very, very clear there's a lot of gaslighting that goes on either through ignorance within the medical arena, or through people, and I think you alluded to this previously, Anna, was about professionals when they don't like to be questioned at all.
Yeah. Yeah, definitely. I think we've got to understand that not every medical professional is going to know everything. And, especially I feel for GPs, I really do, because they have a short space of time to figure out what's going on with the patient. And they're back to back in clinics and they don't have much leeway. But what I think comes through is, even if you don't know how to help that patient, have the humility to be able to say, I don't know how to help you, but let me find you somebody who can. And that ripples through even to surgeons, consultants, that if they're not sure what to do with you, they should have the humility to say, let me find you somebody. Because I had that issue. So I was left with an indwelling catheter for 4 years, and they're actually only meant to be used for people who are not mobile, or for a maximum of 6 weeks. And I was left with one for 4 years. In the end, my bladder rejected it because it was so unhappy. that I then lost my bladder and had to have a urostomy. So I have 2 stomas now. And I can't help but think, if my first urologist just said, I don't know how to help you, but let me find a specialist who can, would that have saved my bladder, and would that have avoided another massive surgery? And I think it's just knowing when to kind of let go, and that's what sometimes medical professionals don't, and they can also stunt that kind of access to help, because if you get to a gynecologist and they go, so here in Wales it's not as easy as and I know in England it's not as simple either, but in Wales especially, we can't choose where we go, as in with hospitals. So if you need an endometriosis specialist, you have to see a general gynecologist first to then be referred to a specialist. So you're waiting 18 months, 2 years before you get to a general gynecologist. And if you get to that general gynecologist and they disagree with what you're saying, and they go, actually, I don't think you've got endometriosis, bearing in mind with no scans, no tests, no surgery, they could just go, oh, we'll discharge you. And we've seen this happen so many times, and that's it. Their journey stopped and they have to start all over again. And I think that's the kind of real stress point for patients, is the fight to just be listened to. And not every medical, bear in mind, we work with some incredible ones. We have incredible ones ourselves as patients, but we have come across it in our own patient journeys, is they're often dismissive sometimes. Your age can be a lot to do with it. Your gender can be a lot to do with it. There is a massive gender health gap. You know, it's one of those subjects not everybody wants to talk about, but there is. It is absolutely prevalent in the NHS at the moment.
I think what's hard as well is what we were saying about GPs having so little time and also not being trained in certain things. Like for me, when I was going back and forth trying to get diagnosed and being told I had IBS, they finally referred me for a transvaginal ultrasound, which was so painful, cried all the way through, went back to the GP and she was like, it's inconclusive, you'll have to go for another one. And I was like, I don't know if I can, because it was so painful. And her words were, well, if you really cared about your health, then you would do it. And I was 21 at the time, and I was absolutely devastated. Left there, and then I spent months and months and months in A&E, went back to see a different GP, and she was like, let me just have a look at your transvaginal that you had. And she said, oh, I can actually see traces of endometriosis on your scan. Then I finally got sent to gynae. But it's things like that where either the doctor is resistant and doesn't really want to look at it and kind of just wants to fob you off as a patient, or they just don't know what they're looking for on a scan. And I think this is the problem when they refer you for an ultrasound. If it doesn't show anything, it doesn't mean that you don't have endometriosis. And the same with an MRI. The only foolproof way to diagnose endometriosis is with laparoscopy, keyhole surgery. So a lot of people go for scans and then being told by medical professionals, well, there's nothing on your tests, so you're fine. And there's this big culture of, if you're trying to get diagnosed with endometriosis, you just have IBS, you're just stressed, it's just a period. So I think all of these things kind of really add up and they cause a lot of issues. And I think this is why people are so scared to pursue anything. And I think for us now, we're lucky because we have really good medical professionals, but some people, it takes a long time to get to that point. Some people are really lucky straight off the bat and have a good experience. And I think that's important as well, is that not every experience is negative. Not every experience is positive. There's an even keel. Unfortunately, sometimes the negative does outweigh the positive. But I think as a charity, a big kind of ethos for me and Anna is bridging the gap between patient and professional. That is so important, because we
absolutely. I think it needs both. It's a partnership, really, isn't it?
Massively.
We need to build that trust back for people, that not all medical professionals are going to behave in a negative or dismissive way.
Because it does stay with you when you've been gaslit or ignored. Because like for me, I had a new consultant with rheumatology and I was absolutely petrified going in, because
I think they're just going to say no to everything.
I was wholeheartedly just in the mindset that they were just going to ignore me and I was going to be sent on my way. And she didn't. And she was incredible. She was amazing.
Refreshing,
And,
isn't it?
and I think that is the importance, is just because you've had one bad experience or even multiple bad experiences, that doesn't mean it's going to be every single time. And we've got to understand that they're up against it as well. You know, they have a lack of funding, they have a lack of training, they then have a lack of kind of resources. So with endometriosis, we know there are some sonographers and radiographers that can read it on scans, but they're very few and far between in the UK. We don't have every sonographer and every radiologist able to identify it on a scan. So that's why it's so important that patients aren't just kind of discharged after having a scan. They should then have keyhole surgery if their symptoms are persistent and correlate with conditions.
People need
like
to know the
endometriosis.
damage
They
that's been
do.
done to their body. They can't be left in limbo.
And they need to not be ignored. And I think that's the biggest point. But the biggest thing it boils down to is the government funding the treatment and funding the need for extra theatre time and extra clinics, and to recognise that this isn't going away. And by ignoring it, you're costing the NHS that much more money. And we need to understand the condition to be able to help so many patients. We're 1 in 10 in the UK. You know, that's not a rare statistic for endometriosis.
I think it's probably about 1 in 5 or 6 now.
I'd say
think it's risen a lot.
Without the recognition for it, we're just going to keep getting worse. And we've gone from a 7-year diagnosis time to nearly a decade. And, you know, there is an element of COVID causing a problem. And, you know, we can't keep blaming COVID, because the problem and the delays were there before COVID. And I think it's just exacerbated it. And we need them at government level to recognise it and to take it seriously. And I think you know, our medical professionals that we work with, they're begging for extra theatre time to help patients. They really want that time.
I think a lot of medical professionals who are really trying to change the way the system works, I think they feel really stuck and sad, hopeless, in a sense, because I think you get a lot of them that really do want to help, and they're frustrated because I feel like, especially kind of primary care, they can only take you so far. And the same, like, once you've been diagnosed, if you then have bowel issues, bladder issues, you then have to be referred on and on and on and on, and so it goes. And I think that's where we are frustrated at the minute, both of us, trying to navigate other conditions and organ damage and all of these other things that come with it. And I think this is why me will always fight, no matter how bad our health is, we will always fight and advocate and campaign for ourselves, but for everyone else as well.
Well, thank goodness we've got you, to be honest. Thank goodness. So
I think that's the one thing I would say with medical professionals is it's absolute key. And like Gab said earlier, patient and professional. And as a patient yourself, you have to be happy with the treatment line that you're going in. And it's okay to say what fits to you. So if you don't want to try a certain drug, or you don't want to do, you know, scan, or you don't have to do that. And that doesn't mean that you're not receptive to help. It just means that does boundary. Heard it often where women and those who menstruate are being refused having their coils removed, for example. You know, it's just a right that they're allowed to say, I want my coil out because I don't want it anymore. You know, we can't refuse patients because it's inconvenient to the health system. We need a health system where it supports women who menstruate.
It needs to be patient-led at the end of the day, doesn't it?
It does.
Absolutely. So what we will do, so first of all, thank you very much, both of you, for your time. It was interesting. It was really interesting. It was educational. We're going to publish all the toolkits as well, because I think that's really, you know, that is fundamentally where we can make an immediate difference, with putting the toolkits out for everybody to be able to look at and see. And also, congratulations on your award. That's
Thank you.
Excellent. You know, well deserved. So thank you both very much.
No, thank you so much.
Thank you. Bye.
Bye.